Thank you for joining us this evening. I am Joanne Troutman. I'm the President and CEO of Greater Susquehanna Valley United Way. I want to thank all of you for attending, but especially all of our panelists who have come here tonight sort of at the last minute to give us an update on what's happening in our community related to COVID. As many of you know, we have seen numbers dramatically increase over the last several days and weeks. The holidays are coming up. Lots of people are making difficult decisions right now about what to do and how best to protect their families. And so I'm hoping we can get some of those answers this evening. So how we're going to do this evening is I'm going to introduce each of the panelists individually. They're going to say a few words, kind of share their perspective about what's happening both in the community and in their organizations. I have some questions to ask, but I also invite all of you to share your questions and thoughts either through the Q&A section or the chat section on Zoom. You're also welcome to do that on Facebook. We have staff who will be getting those questions to us. So again, thank you for coming this evening, and we're going to go ahead and kick off and get right into the discussion portion and presentation portion. So we have representatives here tonight from all of our major healthcare organizations in the area: Evangelical Community Hospital, Geisinger Health System, and Family Practice Centers. It's my pleasure to first introduce Benjamin Willard. He is the Chief Financial Officer with Family Practice Center, and he's going to share a few words, and then we'll invite our other panelists to speak. So Ben?
All right, thanks, Joanne. First, I want to start off by thanking you, and I'm happy to be a part of this event. So, hope everyone finds this public health forum both informative and helpful. Like Joanne mentioned, my name is Benjamin Willard. I am the CFO for Family Practice Center. I think first I would like to start off by discussing the importance of seeking care when necessary, as well as wearing a mask, during this pandemic. I think that's very important. One general trend that we are seeing right now, speaking with our physicians, is a lot of patients do not necessarily believe they are infected with COVID-19 because they're not showing specific symptoms such as a fever. That's the big one that we hear often. It's important to note that symptoms do not just include fever, cough, loss of taste and smell, shortness of breath, like previously believed. Many patients, in fact, that are diagnosed confirm that they don't have many symptoms at all. Some have a headache that is frequent, nasal congestion, GI issues. So it really can be anything, which is part of the problem, and what makes it scary is the unknown. But again, it makes it even more important to seek medical care when necessary, when you think you might have symptoms, and contact your primary care provider and seek their guidance. Additionally, if you have prolonged contact with someone who has been diagnosed with COVID-19, it becomes even more important to follow CDC guidelines, which is the quarantine and seek testing if symptoms develop. In order to prevent the spread of COVID-19, it's imperative that the public, we will wear masks at all times. Masking is something that we take very seriously here at FPC, and we firmly believe that it's the key to keeping everyone safe. Moving into the holiday season, in order to stay safe, we should really consider staying within our own households for holiday gatherings, events. Bringing a bunch of people together in a enclosed area drastically increases the chances of spreading the virus. I know we're all faced with this tough decision, myself included. I'm sure everyone on this call in the holiday seasons, and being from Central PA, we know that we have strong family ties, and that's something that's big in this area. But mitigating the exposure is very, very important, and we have to remember we're not only protecting ourselves but protecting everyone. So even if you're young and healthy and you think that you're immune, it's just important to remember there's a lot of unknowns about COVID-19, and that's again what makes it so dangerous. These unknowns present immense challenges in terms of keeping the overall population safe. So I think that's something that from FPC, we really want to reiterate that it's a tough decision here moving in the holidays, but we feel it's important to mitigate the spread. I would like to talk just real briefly about what we are doing as an organization to ensure that our employees and patients are safe. I've talked about this at previous town halls and forums, that seeking routine care through the pandemic is really, really important. If you go back to March and April, when shutdowns were put into effect, a lot of individuals unfortunately had to push off routine care, and it led to some bad results in the following months. Patients that have conditions such as heart failure, COPD, diabetes, etc., they need routine care, and it really is imperative to avoid unnecessary hospital stays and overall bad health outcomes. So due to this fact, here at FPC, we focus heavily on creating that safe environment. We've implemented policies to mitigate the risk of potential COVID-19 positive patients, physically accessing our facilities, following proper screening protocols. Across organization, our offices have drastically changed the way patients access the facility on a daily basis. First off, patients are required to have their temperature taken and logged. I think that's a pretty commonplace action now, but it's still important to catch someone who may have a fever caused by COVID-19. Additionally, office staff are working diligently to clean on a very routine basis in between patients. Additionally, if patients are screened with symptoms that are well-known COVID-19 symptoms, such as the ones I mentioned before, we're doing everything possible by either offering televideo visits, using separate rooms, separate entryways, everything necessary to ensure that if patients do need to come into our office, it's a safe environment. And if possible, and they do not need to come into our office, we're utilizing televideo visits pretty frequently at this point, and we have done so throughout the past 8 months and throughout the pandemic. So, from our perspective, we think it's very important to continue to seek your routine care and not put it off because it's imperative for your health in the future. Lastly, we've instituted masking policies according to CDC guidelines for our employees, but we also require our patients to utilize masks. It's another testament that we believe masking is very effective and is very important here in the pandemic. For our staff, we require employees who are consistently in direct contact with patients to wear an N95 or equivalent mask that we believe are proven highly effective against the disease. Non-patient contact staff members are still required to wear at least a surgical mask at all times and perform social distancing between other staff members as much as feasible on a daily basis. And also, we do require all of our staff members to have their temperature taken on a daily basis as well. So again, we really are focused on creating that safe environment to ensure that patients can access healthcare if needed. Moving forward, we're looking to continue to operate our clinics in a safe manner so patients can access our facilities. We have also created some off-site testing locations where if a patient is screened and believed to have COVID-19, that they can then be seen via televideo visit and directed to one of our 3 testing locations to, again, keep that type of patient who possibly is infected away from the office and keep other patients and staff members safe. At these testing facilities, they're better set up and better prepared to collect the specimen by having certain barriers in place, obviously donning the appropriate PPE. So it's a better environment for, again, the patient and the employee. One thing I do want to mention is, behavioral health and its importance on a normal in a normal time, but obviously even more so important now during the pandemic. And one thing that we're trying to do is continue to enhance our behavioral health presence. At this point, we have over 15 behavioral health specialists across FPC, but more recently, we've hired 2 behavioral health specialists here in our site in the Susquehanna Valley Mall. And we're also looking to add another behavioral health specialist in this location. It's proven to be a needed service. Within a month, they were almost fully booked. So we're going to continue to try and open up slots and enhance the behavioral health care in this region. That's very important for us moving forward. And then lastly, I just want to, just thank everyone for joining the call and look forward to hearing from the other panelists and appreciate your time. Thank you. Thanks, Joanne.
Thanks, Ben. In particular want to applaud you for your renewed commitment to behavioral health. You know that that is a big focus for United Way, and we're really proud of the work that you're doing there in particular. So thank you. And I'd like to introduce next Kendra Ocker. She is the president and CEO of Evangelical Community Hospital. Kendra, are you with us? Are you ready?
I am. I was having some difficulties, but hopefully you can hear me. Thank you, Joanne, and we greatly appreciate the United Way and all you're doing to keep the community informed about the ongoing COVID pandemic. As Joanne noted, I am Kendra Ocker, and I'm going to discuss what is happening within the walls of Evangelical Community Hospital right now. As of this evening, we have 6 patients in the COVID ICU, 17 patients in the COVID unit. There are 4 patients waiting in the emergency department for COVID beds to become available. This is on top of all of the other patients in our care in other areas that we are taking care of. So we are extremely busy right now. We are creating new separate and safe non-COVID ICU that will open tomorrow. We've added 4 negative pressure COVID beds to the existing ICU to be able to handle 10 COVID ICU patients. We're prepared to expand COVID bed capacity within other areas of the hospital as the need arises. We're set up to open an outpatient clinic for monoclonal antibody therapy by infusion next week. We have also opened a respiratory assessment clinic at our urgent care center at West Branch Medical Center from 8 a.m. to 8 p.m. daily for those with mild to moderate respiratory symptoms that require provider assessment. I would like to mention that we also have adequate PPE within the facility. That is not something we are extremely concerned about at this point. At the alternative testing site, we are daily testing at record numbers. In the last 2 days, we've tested close to 200 people. We're averaging for us about 160 tests daily. That's up from last week of about 130. Over the past 3 weeks, our positivity rate has been 12.3%. And in the last 7 days, that has climbed to 18%. I want to note that this is the same rate that we had in the spring during the first round of COVID. It is not true when claims are made that we are testing more, so the rate is higher. It is statistically the same numbers that are testing positive. It's just that the virus is spreading. It's a simple math equation. From a hospital perspective, as an example, Lynn Yanis, who you will hear from this evening, and I discussed, she and I talked yesterday, that within 6 days last week, we had 35 patients admitted with COVID. And the truth is for us, from March through August last year, we did not have 35 total patients that were COVID positive that were hospitalized. So the increase in COVID-19 patient comes at a time when we've experienced increases in patients with other hospital needs, health needs that require hospitalization. This combination is truly taxing on our resources. Clearly, COVID has been in our area, but it's spiking at present, and we need the community to take this seriously. For many people, the issue of COVID-19 is probably more political than based in actual everyday reality. And for us, this is a real public health crisis, and people need to respond with a serious sense of responsibility. We find ourselves as health professionals in a time when many people don't believe what we say. Please believe me when I tell you this is real for me, and this is very real for my staff. This is not political. We are caring for your parents, your aunts and uncles and siblings, and your neighbors. It is demoralizing to my staff to be working day in and day out to take care of the community that is very ill. And we are seeing in them in increasing numbers with COVID. And we see people who don't believe it's true and who won't do the simple, respectful action of wearing a mask to protect themselves, but more importantly, to protect other people. The public needs to have patience with us during this time, but it also needs to be prudent in managing the spread of COVID. COVID is in our region, and like all healthcare providers across the state, Evangelical's resources are being stretched. We're nimble. We're going to adjust our staff and services as much as we can, but we can't be in this crisis alone. We need the help of every member of the communities we serve. Do your part to care for others and follow the state and hospital guidance to mitigate that spread. as simple as it sounds, wearing a mask, it does work. Staying physically distant from others in public spaces, disinfecting to often touch surfaces, and practicing good hand hygiene. All the things that we've been talking about for months are vital tools in keeping the spread held back. And you should feel comfortable though, and I want to stress this, and I was having audio difficulties, but I did hear Ben touch on this, that you should feel comfortable to get the care you need during this time. Don't put your health at risk. We've learned a great deal clinically and operationally over the last 9 months when it comes to managing through the pandemic. We've developed effective processes for identifying, segregating, and safely caring for potential COVID patients as they enter our emergency rooms. We can safely perform surgeries, deliver babies, draw specimens for lab testing, and administer imaging tests. We've expanded our use of telemedicine and employed staggered appointments and physically distanced waiting areas to ensure every clinic, every office is safe for the community as they seek to address their health needs. And we've learned more about how the virus moves through the community. While this does move through communal living areas like colleges and nursing homes and prisons, it also moves through communities. It does most of the time affect those most vulnerable, the elderly, those with underlying health conditions, but it also at times surprises us by who it affects, seemingly otherwise healthy individuals of all ages who struggle to overcome it. So I will also echo some of what Ben said. We are seeing a huge increase in behavioral health type issues and patients who we are trying to desperately find beds for who need mental health services. So this is a tough time. It's also a very tough time for the staff. You have to consider their mental health, and they've been doing this for a really long time without any meaningful break. And the stress is getting greater and greater, and yet the public seems to sort of handle it differently than it did in the spring, and just has sort of gotten used to it and has maybe stopped thinking about the demands on our healthcare staff. So I would encourage you to think about that and to think about the stress of those people. But please know that we're here for you and we are doing our best. The entire region is challenged, and we do work cooperatively to care for our communities. We're in this battle with our colleagues from Family Practice Center and with Geisinger. And so I will let Dr. Rue kind of give you his perspective on what's happening in his organization at the present. Joanne?
Kendra, Dr. Rue, I think she segued to you very well.
Yeah, thank you, Joanne, and thank you to everybody. Great comments from Ben and Kendra, and I would echo many of those. And you're about to hear from others, and I imagine we'll be saying very similar things because we're all seeing the same thing. Why? Because we're all working in the same community. And I think that's a good illustration of how you know something's real is when multiple people, multiple organizations are fighting and realizing the same exact thing. So I thought I'd just take a moment and talk a little bit about what we're seeing and also a little bit about what we're doing and why. And lastly, what can we all do? And I think some of what we're seeing, I apologize in advance because I got some data here for you all. And Joanne, I don't know if we could I did submit one graph that I thought sometimes a picture's worth 1,000 words. And we do get asked the question a lot. So if you could flip to the graph and maybe share that on the screen. And I'll do a little bit of voiceover to describe what it shows, although I think many people will get a pretty good picture.
Beth, I think, can you pull that slide up?
So while the slide is coming up, and there I see it now, you could see just since October 1, what Geisinger has seen as far as COVID positive patients in our hospitals as hospitalized patients. And of course, I think I'd start with a couple myth debunkers because I think there are sometimes questions and people say, well, maybe the activity is because we're testing more. Well, testing may impact how many people are testing positive, but it shouldn't impact how many people are landing in the hospital with COVID because the hospital criteria, how we determine whether someone's sick enough to be admitted, is something that has not changed throughout this pandemic and won't change. So oftentimes it's a good reflection for us. Think of it as the canary in the coal mine that tells us, is the disease picking up steam or is it losing steam? And What we saw back in the spring, we peaked around 130, 140 patients in the hospital. I believe it was the 3rd week of April. And you could see that for the last couple of weeks, we've blown past that. And now every day since then, we've established a new peak. And we're now up above 180, close to 190 across our system. And we broke it out into our subregions, and you could see that the central area, or what we call central, sort of Union, Snyder, Northumberland, Montour County, that area you could see in green. And that's been in recent weeks really contributing and being the main driver of the overall system growth. As far as our testing, the other leading indicator that we frequently look at is what percentage of our tests are coming back positive. Because again, as Ben described and Kendra described, we do follow a set of guidelines and criteria to figure out who needs to be tested. Those criteria have not meaningfully changed. And so when we see that percentage that test positive climbing, we know that that's cause for concern. And so a few stats on that. Early in the month, we had a positive testing rate about 9%. In the 2 weeks since then, we've had a positive testing rate of about 14%. In the last several days, and really think of this over this last week, our positive testing rate has now climbed above 20%. And just for comparison, in the summer, our positive testing rate was lower than 3%. It was less than 3%. And so what you see there is a significant climb in the activity level of the virus. And that means, in fact, it is community spread and it's in the communities. The other thing that I should mention about the folks that are in the hospital, unfortunately, because they're sick enough with the disease, another myth that we frequently hear is the belief that the bulk of these are actually from our nursing homes in our communities. Can't be further from the truth. In fact, from our actual numbers and data, it turns out that it hovers between 10 and 15% of our overall patient volume from COVID is from nursing homes. That means 85 to 90% of the cases that are sick enough to land in the hospital are actually not nursing home patients at all, but they're in the community. They're much like any of us on this call today. Another myth that we frequently hear is, well, only the folks above 65 really need to worry, or only the folks who have chronic diseases need to worry. Well, it is true that those populations are at a higher risk of getting substantially sicker. What we also see is only about 2/3 of our patient population is 65 and older, which means a solid third. And in recent weeks, it's been as high as 41% of our patient population is actually younger than 65. And actually half of them are younger than 55. And so it really starts debunking the myth, I think, that a lot of folks in the community may have, and certainly we've all had at various stages of this pandemic. But those are the facts that we're seeing. Even the young and even the healthy, believe it or not, can be hospitalized, can be very sick. We have some folks that are in their 40s with no chronic diseases whatsoever that are on ventilators in our ICU right now. And so I think that's important to really understand the facts behind what's going on. The other astounding fact that I heard earlier this week is we are now at the point where every hour someone is getting hospitalized to one of the Geisinger facilities with COVID. And so the rate of climb on this is really concerning as we head into the holidays, as we head into colder weather. And so that's a little bit of giving you a glimpse of what we see as far as what we're doing about it and why. These are the reasons why you'll see visitation limitations back in our hospitals. And Kendra mentioned this in Evangelical as well. Masking is absolutely mandatory at every single one of our facilities. And you heard that from both Ben and Kendra. We are screening everybody at the door, as you also heard from Ben and Kendra. We are also dialing down our elective procedures by about 15%. We know that a lot of those procedures still have medical urgency. Obviously, that needs to happen. But some of the things that are not as urgent, not as pressing, and are truly emergent or truly elective, We've dialed that back about 15%. And as a result, we request your patience. But the reason why we're doing it is because when you have a virus that's raging out of control right now in the community, and as a result, many people are getting hospitalized, we have to have the staff, resources, the beds, and so forth to take care of that population as well. And so we're actively managing that, believe it or not, by the hour. There's a task force that meets across our organization, and you'll probably hear some of that from Janet Tomcavage, our system chief nursing executive, where we're managing that pretty darn actively. What can we all do? And this is where I would finish. We can pull together, believe it or not. We have seen, and throughout the summer months, I think it was very effective. We've seen that things that we have learned about this virus are tried and true, and they are effective. And it's simple things like masking and making sure that we avoid gatherings of people. And we urge our employees, but also urge our communities, because it's really going to be all of us, that we got to be careful about congregating in indoor spaces in particular, but being near folks that are not in your household without a mask is really asking for trouble. That's what this means. And at the rate of spread that we're at, it means that there's a good chance that your interactions with folks in your communities are really risky behaviors. And so we have to be careful about that. Now, if you're outdoors, you're not near other folks, you know, those are safer environments. If you're outdoors and you're distanced and masked, very safe environments. But if you're indoors and you're gathering 10, 20, 30, 40, or even hundreds of people without a mask, that's what's contributing to the spread right now. And we absolutely need to play our part, all of us. And that's why you're hearing us all get together on this call to urge you to do that. So I'm going to turn it back over to Joanne. Thank you so much again. But we really urge you to take an active role, because as much as, you know, hospitals like ours or EVAN or medical groups like FPC or ours or EVAN, as much as we can do, we can't do this alone. And we're going to need the help of everybody in the community. And it starts with everybody here. I think I saw at last count, we have over 400 people. That's 400 people that we can really start this movement to make sure that we're bending this trend. And if we do that, we'll be back into the same kind of position we were in the summer, which is a much better spot. And of course, with the vaccines imminently coming on board, although it'll take a while to get those distributed. So that's not going to happen anytime soon. We're going to need to get good at practicing and exercising this muscle so that we all stay safe heading into the, hopefully, you know, next handful of months here with the pandemic. So thank you all again, and I'll turn it back to Joanne.
Thank you, Dr. Rue. And I just want to thank all three of you for being honest and forthright, not just about what's happening, but about you on what we should be doing. I'll share that today our family canceled all of our Thanksgiving plans. And I'm happy and proud that we were all on the same page and have done that. I know before this recent surge, if you didn't know somebody with COVID, you probably now know somebody with COVID or several somebodies with COVID. I personally have dear friends who are in quarantine right now. One family attended a surprise birthday party over the weekend. Next morning, the host family woke up with fevers, and now everybody has COVID. So it is really, really, really scary. I want to shift gears a little bit now. We have a couple of folks on the panel who have the sort of that frontline experience and are connected with those who do. I'd like to introduce Janet Tomcavage. She is a chief nurse executive at Geisinger Health System. Have done some work with Janet around social determinants of health, and she's got a lot of great experience. So Janet, do you mind telling us what your nurses are seeing?
Sure. Thank you, Joanne. Very much appreciate the opportunity to join the forum this evening, and really in a lot of ways to be with friends and colleagues from FPC and EVAN, and I've gotten a few chats from a couple of friends that are listening in. So thanks for taking time this evening. You know, you've heard a lot this evening from the speakers about how significant the risk is in our communities and right here in Susquehanna Valley, the Valley, as we often call it. And, you know, I've lived in this Valley for all of my life, and it means a lot to me to be in this community. And it's our responsibility to really respond to this crisis. And I think if you've heard anything this evening from Ben and Kendra and Dr. Rue, it's really important that we take this serious. It spreads easily, and it doesn't care who you are, right? It doesn't care if you're young or old. It's spreading across our communities at really, I have to tell you, alarming rates, and it carries really significant risk. And, you know, as a nurse and rounding, Jaywan and I round on a regular basis through all of our hospitals, the devastation that's being caused by COVID is just overwhelming. And if you've not seen patients that have been hospitalized or know anybody that has this condition, it is really felt deeply by our frontline workers. The exhaustion, the fear in some cases, just really the unending, you know, kind of tired feeling is just deeply emotional, not only for our workers, but families. And often our workers are really substituting as families for these patients during this COVID crisis. And ultimately it's impacting our communities. You know, as a nurse at Geisinger, I'm often asked how the community can help our frontline workers. And so I've asked the frontline workers, what do you want from the communities? You know, you want more food, you want pizza, do you want, you know, drinks, but that's not what they want. They really want us to stop the spread. When I have asked the teams, what can we do for you? Their word is help get the word out to the community that we have to stop the spread. They see the devastation day in and day out. They hold your loved ones' hands when they pass. You know, they hold the video so that you can connect to your family. As we know, many folks that passed away this spring because of visitation, we didn't allow families to be. And so just, you know, stop the spread, take accountability for this work. And there's really three things, and you've heard most of them this evening. So I think it's going to be a revolving cycle of what you're hearing from us, but I think it's extremely important. The slideshow that you saw at the start of this meeting, Mask Up, I think is just absolutely critical. And when I think of masking up, I also think of how you wear your mask. It's discouraging to go to the grocery store or to Target or Walmart or wherever, and we see people with masks and they don't have their nose covered, they don't have their mouth covered. The mask really needs to be worn appropriately. So we know folks are tired of wearing their masks, but we really need to stay diligent or, you know, with masking. And I would even just encourage your families. If you're not with your normal household family, you need to mask up. Protect yourself, protect others. And the evidence that it's out there, you know, absolutely supports this simple fact of wearing a mask makes a difference in saving lives. The second thing that I think many of us have probably gotten a little lax on is you've got to practice good hand hygiene. You know, sanitize, wash your hands often, just practice, you know, those safe things that we've taught our kids over the years, but somehow I think we've gotten a little lax on that. And then finally, you've heard the social distancing. The upcoming holiday season, I think, is going to be critical for us. I think we found in the hospital that, you know, outbreaks, whether we're working in the nursing home, and we've done a fair amount of work, as Dr. Rue indicated earlier, about nursing homes, where we found the outbreaks from nursing homes was in the break room. When staff in the break room would take their mask off and eat as a group, oftentimes maybe sharing food and those sort of things. So the simple task of having dinner with your family can be, unfortunately, a dangerous place, particularly if you've got family that are coming in that's not your normal group. So I would, really implore our communities to limit family get-togethers this coming week with Thanksgiving. Use your technology to really share your holiday time with friends and family, because really the sooner that we limit the spread, and hopefully with the new vaccine, as Dr. Rue indicated, the sooner we're going to get through this pandemic and we can get back to celebrating our families, our communities together. So just would leave folks with those 3 steps: mask, wash your hands, and stay socially distant, because I think it's a critical way for us to make a difference in our communities. Joanne?
Anna, thank you so much. And my mother is a nurse case manager at Geisinger on the COVID floor, one of the COVID floors. And I can tell you that she's probably out there right now cheering on everything you said. So I really appreciate it. All healthcare practitioners, almost regardless of their specialty and their location, have been significantly impacted by this crisis, but probably none more than those doctors and nurses and providers that are in the critical care units at our hospital. So we're really lucky to have Lynn Yanis here with us from Evangelical Community Hospital. She is the critical care manager at EVAN. Lynn, can you talk to us a little bit about what you're seeing and what your staff is experiencing?
Yes, I just wanted to thank everybody for including me. I can speak for myself and on behalf of the team that we have here. I couldn't be prouder of the nursing staff that care for these COVID patients and have done so every day since March 24th, when we received our first patient. And, they do it and they don't complain. And ironically, our absentee rate is less than it would be normally at this time of the year. The staff are they're tired. They are really tired. It is exhausting for them. It is mentally taxing, but they do such a great job. And I have to echo a lot of what Janet said and Kendra, and the hospital is working very, very hard trying to get us more negative pressure rooms and buying equipment and putting up plastic walls and metal walls. And they're doing a phenomenal job, but you can only get so many people in here. And we really need the public to really seriously take this seriously. It is devastating to be in here with these patients and watching them die alone. And they're shut behind a 2.5-inch thick wooden door, and they're alone. They're completely alone unless the nurses are in there, the aides are in there, somebody's giving them care. And we talk about how hard it is on the nurses and the public needs to mask, but this is very traumatic for the patients. It's hard to get better and be well when they have got to be so depressed in there. They can't see their families. Their families drop them off at the ER. Okay, mom, go in and get your symptoms checked. They're going to swab me. The ER doctor calls the family who's waiting in the car because they can't come in. Yep, we're going to admit your mom. And 3 weeks later, they never saw their mom again. She died. And it's over and over. Like, you don't realize how the public, unless they see it or listen to us, really, really listen to us, it's hard for them to understand, but they need to take this seriously. It's not the flu. I've been doing this for 30 years. I've had the flu. I've seen the flu. This is not the flu. This virus affects other organs. There's long-term effects. We've had people be here for a couple of days, then they go home, then they come back, then they go home, and then they come back. It's just an ongoing process. And it's very disheartening. And I've heard people say, well, you signed up for this. No, we didn't sign up for this. We signed up to be caregivers, to give people the best possible life that they can live, to care for them and hold their hand when they're dying and make their hospitalization a positive experience, that's what we signed up for. And like any relationship, there's a give and take, and it's 50-50. And our relationship with the community, we're doing an awful lot. And there's a lot of people out there that are masking and are social distancing, or our numbers will be higher. But because of this surge, and if you look at the statistical data, you can see there are a lot of people that are not masking and are not social distancing, and they're having their keg parties, and they're having their football parties, and they're having, you know, the birthday parties. And for some people, that may be their last birthday party. And get-togethers this Thanksgiving may result in somebody's last Thanksgiving. And people need to realize that this is serious. Even my family, and they love and they support me, and they don't understand. Unless you are here and you've held the hands of a dying person whose family can't come in, there are no words, truly. The hospital has been very, very gracious. They got some iPads for us that we can have the families FaceTime, and that's great. But we have the plain community, and they're not out there with iPads. And we have the older population. So the 70-some-year-old that's in here, maybe they have an iPhone, maybe they have an iPad, but the wife is at home and she's sick too, and she's too sick to be able to do this. And if it, you know, it's the nurses that become that surrogate family, like Janet said, and it's hard on them. They spend hours in these rooms with goggle and a face shield and an N95 and a vinyl gown, in addition to what, you know, their scrubs and their reading glasses. And they're in these rooms sometimes for hours. And then they come out of that room, they doff, they sanitize, they gown up, and they do it again and again, all day long, every day. And they're tired. They really are tired. And I'm not discouraging people from coming into the emergency room. If you need medical care, you obviously need medical care. But you have to really think about what you're doing. And is it that important to go to TJ Maxx? I'm a shopaholic. I'm not going to TJ Maxx. You have to really be careful. And I was talking to, I think it was Kendra yesterday, you know, you're in the line at the grocery store and, you know, you turn around and there's somebody that doesn't have a mask on. And I find that so inconsiderate, and the kindest, most loving act that anybody could do for somebody else right now that doesn't cost a thing and you don't have to say a word is to wear your mask. Because the person I'm standing next to in the grocery store maybe just had her last chemo treatment, but she had to come to the store to get her medicine. Maybe I'm sick, I don't know it, you know, and I give something to her, or vice versa. There's so many different scenarios you can play in your head, but it's not worth it. It's really not worth it. I am a smoker. I don't want to gamble and get this virus. I don't think I would fare out very well at my age. Some people just get the low-grade fever and they get achy and they stay on the couch and they say, oh my God, that sucks, you know, and they're tired for weeks. I don't want to take that gamble that that's going to help. It affects me, because who knows? We've had patients from 18 to 107. And like Dr. Rue said, it's not an old people disease. We did get hit in August with some nursing home incidents, but it's not. The average patient that we have today is 72. And when people are living to be 107, 72 is young. And I'm 55, so 72 is young. I would say a lot of the things that the other panelists did, and just there's 400 and I don't have my glasses on, 400 plus people on. And if each one of them got 5 people to mask and to take this more seriously, you know, that's thousands. And they tell 5 people. It's like that Herbal Essence commercial from, you know, you tell 5 people and they tell 5 people and there you go. But it's important. We are busting at the seams here. The hospital's doing everything they can, but you can fill every nook and cranny and make it a negative pressure area. But if you don't have the staff to take care of it, to take care of those patients, and it's not that we're not trying. There's nobody lining up outside the door trying to be like, oh, hire me. It's not a good time to be a nurse. And it's going to affect nursing for many years, because I doubt that there's a lot of applicants for nursing degrees right now. Travelers, we have 9 travelers, and we would be sunk if it wasn't for them. They help us out tremendously, but we can't even get travelers anymore. The ones that are out there, they're being sucked up, places that can pay them more money or whatever. You know, we're a small community hospital. We have the lovely Prime building, but we only have so much space and we only have so many resources. And it's not getting any better. It's going to get worse before it gets better. And people really need to understand what's going on out there. Excuse me. Here. So I don't know. I just am so proud of the girls out there. And I mean, the staff have literally passed out from dehydration coming out of those rooms. It's kind of a thankless job up here. But you know what? It's a group and they're sticking together and they're doing a really, really good job.
Lynn, can you just clarify the meaning? What is a traveler? A lot of people won't know.
Oh, it's an agency. So they go through an agency, and let's say I was 20 and I wanted to travel and I decided to go to Connecticut, and I work in Connecticut for like 13 weeks. Maybe I want to stay there, maybe I don't, then I want to go to Hawaii or wherever. So we have some travelers from State College area, Altoona, Reading, mostly that kind of area, but they come here for 13-week contracts and they help us out. And sometimes most of them end up staying for as long as they're permitted to be here, because we're a great place to work. And we would really be sunk without them.
Thank you, Lynn. Thank you so much. And I really can't thank you for everything you are doing and your team is doing. And a lot of what you said really hit home to me.
Yeah,
I'm
I'm really super proud. I'm a proud mama of these guys.
You should be.
So is our director, Kelly Solomon. I would be amiss if I didn't mention her.
Kelly is wonderful. She is.
Kelly is wonderful.
Well, thank you so much. And we're going to have some questions coming up. Our last panelist, Ben talked earlier about the clinic environment, the outpatient clinic environment. And our final panelist is Dr. Margaret Still. She is a community medicine physician at Geisinger Lewisburg. So Dr. Still, can you talk to us about what you're seeing in the clinic?
Yeah, so thank you for the opportunity to talk, and also for all of you and all the hard work that you've done. We so appreciate it here. And Lynn, their stories were just so impactful and meaningful. We're so appreciative of all the work in the ICU. So I've been practicing medicine in Union County for almost 25 years, and I'm at the Geisinger Clinic in Lewisburg. And we have worked really hard to follow the policy and make the changes, as have already been discussed. And one other point that I will make is that we feel, and under Dr. Ru's guidance and as well as other health leaders, just the importance of getting flu shots this year. And I would also say I'm just so proud of my clinic, because we have probably 35 to 40 staff here, and we're 100% that everyone has already had their flu shots. So we try very hard to make sure we do what's good for ourselves, our families, and protect our patients. Even though not everyone always wants to get the flu shot, that is very important as well. So we've made a lot of changes in our staff. Also, we've had deployments, we've had the uncertainty that other people have faced. And I think our staff has faced it with great grace and poise and really done a wonderful job. We've changed a lot of our protocols, as Ben had mentioned that they do at FPC. We also are doing a lot of telemedicine visits. And I think it's a great tool and a great option that we can use. And I do have some patients who are fearful about telemedicine. They feel that they don't know how to do it. They're not good with technology. And I would say there's so many options and ways we can do it. Many people, especially the older population, if they don't have a device, a smartphone, they often might have a relative, a child, a grandchild who has a smartphone. They can bring it, they can use it. So there's a lot of different ways we can do telemedicine. The person doesn't need to own the device themselves. We're also doing a lot of telephonic visits, and then of course the in-person visits, and also for us, again, with using PPE, the masks, the eye shields, excuse me, and more protection if we need it. We certainly have been seeing rising cases here, and in the outpatient clinic, we're mostly seeing more of the mild cases. So more upper respiratory tract infections, cough and cold, bronchitis. We really do guide people to go to testing centers, testing sites to be checked to see, if they have the illness or not. And we're very careful about screening when we bring people into our office. We want everyone to have the chance to be evaluated, but we don't always want to bring in people if they are acutely ill with fever and we think that we might be able to address it via a telemedicine appointment. We've seen a lot of range also in our patients that started out with mild illness and then ended up going into the hospital. There's a big range of ages, there's a big ranges of underlying medical conditions, many times no medical conditions. And one thing that we're really starting to see more and more in the outpatient arena is what happens to these patients when they're discharged from the hospital. So we are taking care of these patients after the hospital, and we really don't know a lot of the long-term answers. So a lot of them are having long-term mental health issues. A lot of them are having long-term issues with their breathing, respiratory issues, pains, aches and pains, and we're really facing a lot of that in the outpatient setting. So not only is the acute disease virus so frightening, also the long-term effects. We're still trying to learn what to do for them and how to treat them. And so I think I'll just kind of wrap it up with that I would encourage everyone to do what has been encouraged so far, just the masking, the excellent hand washing, and just taking care of our neighbor and being cautious about how we're getting together and how we're greeting each other. So thank you for your time.
Thank you, Dr. Still, very, very much. We are going to dive right into the Q&A portion. We have lots of really great questions from the audience. So I'm going to try to combine some of these and try to get to as many of them as possible. So, and this is really, anybody on the panel can answer these questions. So just weigh in as you see fit. Testing, lots of questions about testing. Where can people get testing? How long is it taking? Asymptomatic testing, is that available? How much does it cost? So please speak to what the current testing situation is.
Yeah, I'll jump in from FPC's perspective to start, and I'm sure Kendra and Dr. Rue will have more to add. And so for FPC, we have utilized the testing sites. We have a relationship with Quest. So a lot of our testing right now is going to Quest, which means we collect the specimen and we ship it out to Quest. In the worst of times, that was a real problem with turnaround time because of the amount of testing that Quest was getting inundated with. Recently, it's been pretty good, meaning within, I would say, 4 to 5 days, although it's not ideal. For a while, we did have our own PCR testing available for the symptomatic patients. There was about a 2-month period where we had that available, which was very, very nice. We were able to get immediate results for all symptomatic patients of FPC clinics. The issue is the supply chain has pretty much dried out. And I just had a phone call this week, and I'm a little bit concerned about the supply chain of that moving forward. So thankfully, we do have that, relationship with Quest. We do have a different option for a little bit higher complexity patients who have comorbidities that we can get a turnaround time immediately with a respiratory panel. That's not our go-to option, but it is available, and in certain situations it does make sense. So from our perspective, that's what we do have available. I am a little bit concerned, and maybe Kendra and Dr. Rue will disagree with me, but I am a little bit concerned about testing here as cases and testing continue to rise, because, you know, over the last 2-3 weeks, to echo what Dr. Rue said, we've seen a big increase in testing, and we also have not seen that myth of, oh, it's inflating the numbers. We've seen that the testing is going up and the percentage is going up. We've also seen the same thing where the percentage was, you know, between, I would say, 8 and 12% pretty consistently. And over the past few weeks, we've had days where across our practice, you know, the percentage has actually gone up to 20 to 30% on certain days. And you know, on a, you know, if you look at a week or 2 weeks, you are looking at around 20+%. So that is concerning to me for the region. And you know, I hope that we can continue. I promise you, from our perspective, and again, I'm sure Evangelical and Geisinger are doing the same thing. We're working hard to use our relationships and leverage those to try and get testing in our region. But it is a national challenge because a lot of these organizations who have created the testing vehicles are stretched as well. But from our perspective, we're working hard to try and get testing for our patients. So that's from our perspective. I don't know if anyone else on the panel has anything to add about testing.
Yeah, maybe I can chime in. I think Ben raised a lot of good points. Testing, as many people know, has been sort of a continuing saga throughout the pandemic, and we're 9 or 10 months in here, and I think it continues to evolve. The good news is there's a whole lot more capacity than when we first started, you know, as a country back in March or even February. So I think that is good news. At this point at Geisinger, we're doing a little over, I think, 2,000 tests a day. And we continue to expand that capacity of doing the tests on site because the timeliness of the results, especially when they're in patients, really makes a difference for being able to risk stratify and so forth. We, like EVAN and like FPC, we follow the criteria. That's really important from a public health standpoint to make sure that we're being good stewards of those testing resources and having enough so that the folks, when they're really critically ill and you need to know whether they're COVID positive or not, having that capacity is really critically important for clinical decision making. I think the other is we know that there are other scenarios where people may not necessarily be symptomatic, but it may merit a test. And that could be based on potential exposure, degree of risk. Some folks, like the nursing home population, you know, there are good clinical rationale to justify testing depending on the scenario. But it is a little bit of a complex algorithm of decision making. And so we always refer folks to our COVID website, but also to our COVID hotline so that we could help sort out whether testing makes sense in a given scenario, given a certain person and their clinical features or not. And so that's what we continue to encourage. And as far as whether or not it's how much it costs and so forth, it really depends on your insurance company. And we encourage folks to check with their insurance carrier as far as which scenarios, what is covered, what is not. The extreme on one end would be you have the symptoms, it's absolutely clinically indicated, and anything that's symptomatic, I think, is one story, versus we do get requests. You know, my kid has a wrestling tournament in South Carolina and they require a test to go there. I think those are scenarios where, depending on your insurance carrier, it may or may not be covered. And there are also consumer oriented testing sites, and I believe the state has a website that really tracks all of those testing sites, and you could of course reach out and find out about those other scenarios from those sites individually as well. So I think that's sort of the advice that we've been giving to folks, but it gives you hopefully a little more clarity, whoever asked the question.
Thanks, Dr. Rue. There are also, shifting gears a little bit from testing, there are a number of questions about beds. Are there enough beds? Are you adding more beds? What is the status of ICU beds right now?
Well, this is Kendra. I can address that. I mean, I kind of did address it in that, our ICU generally houses, 10 to 12 patients normally. And we're in the midst of building a new ICU that isn't quite done yet, at the tail end of prime here. But with the way we've designed the negative pressure rooms in the ICU, we have basically 6 beds that we can use, because you have an ante room the rooms are small. So we have taken some of the space to make ante rooms to Dawn and Doff to get into those rooms. But we've added some more rooms, and we've gotten ourselves up to where we have 10 COVID ICU beds. Because we have other ICU patients that are coming in, that's why we're going to be tomorrow opening up another 7-bed ICU unit. But I will tell you, from an ICU bed perspective, we are, at our max, and we continue to discharge people and move people into non-ICU type beds. But it is a challenge right now, and that's why we work with our partner Geisinger on ICU beds. We have an intensivist. Geisinger does happen to give us intensivist support on the other hours of the day when our intensivist is not there. So we've had this relationship for years, and it's positive, but Geisinger's resources are taxed, and I'm not going to speak for them there, but we are doing our best. But this is why we're speaking here tonight is, we're flexing, we're adding, but you can only add so many ICU beds and do it safely with the staff that you have to cover those beds. So I'll throw it off to Janet or Dr. Rue here to kind of address it from Geisinger's standpoint.
Yeah, so I'll jump in and I'll let Dr. Rue kind of add some color commentary. We have about 150 to 170 ICU beds across all of our hospital platforms. One of the nice things for us is that we have seen shifting kind of census from area to area, and we can often shift some of our higher risk patients to a different hospital if we need to. Fortunately for us, we have 2 large hospitals in Wilkes-Barre, Scranton, and we are often shifting patients between the 2 hospital platforms if we need to. GMC, we've got beds out in Lewistown, et cetera. So I think we're pretty good from an ICU bed capacity perspective. We also have really spent a fair amount of time this spring developing surge plans so that if we need to, ramp up for ICU beds, we ordered more, ventilators in the summer and got those in. So I think we're in a good spot. The big challenge, quite honestly, that I think Kendra probably would relate to as well, and Lynn, is nursing. Really, it's not the beds. For Geisinger, that's the problem. We're hampered by being able to ramp up staff, whether it be respiratory therapists or nurses, to really staff those units. And so that's the thing that probably Lynn and Kendra, and I know others within the EVAN organization, it's really finding staff who can take care of these critical care patients that are just very, very sick.
I think that also underscores the importance of, when you have community spread, which is what we have right now, it becomes that much more critical that we all stay super vigilant and super careful, because of course our nurses, our physicians, all of our staff and at all of our organizations are nothing more than members of these communities. And so if there's more activity in the community, that means there's going to be more activity among our staff as well. And when staff get COVID, they're out because it's the same thing. They have to quarantine and all of that. And you've heard from all 3 organizations the shortages in staffing. And so the beds are one issue. And yes, we're coming up on that capacity, and we've had to dial down the elective procedures, not shut them down the way that we had to back in the spring, but dial it down by 15%. That still allows us to meet the needs of all of our patients in our communities. But the other limitation, I should say, aside from beds, is staffing, as you're hearing.
Thank you. Yeah, I appreciate that. Actually, you answered a lot of questions in there embedded. I know that, at the risk of putting you all on the spot, I feel like something I can't ignore, because there are so many parents out there wondering, and so many community folks who are asking questions about things like school and indoor winter sports and indoor choir practice, community choir practice. So do any of you have any wisdom or thoughts about this decisions being made around continuity of education and in-person activities in education?
I suppose I could start, although I was wondering if Dr. Still might take a stab at this one as well, not to put her on the spot. But what we've told people on this is that it's really a balancing, and people are searching for, and we get it too. You know, we're parents as well, but they're searching for a clear-cut answer, and it's almost a, you know, they want to put everything into the formula and it spits out a right or wrong answer. And I don't think it's that easy. It's very nuanced. And so you have to take a lot of things into consideration to assess how risky or not risky is a given activity. Here are some things we know without a doubt, and we've learned them through the course of this pandemic, and these things have been true before and they're still true. In fact, we've reinforced and confirmed that they're true. Outdoor activities are better than indoor activities. Masked activities are better than unmasked activities. Smaller numbers are better than larger numbers. Wide open, if you're indoors, big open indoor spaces is better than small contained indoor spaces. Fewer people is better than more people. Distance from the people is better than being in close proximity to people. And so whatever activity you're talking about, of course, masking is better than not masking. Whatever activity you're talking about, I think those are sort of some of the considerations you have to take into account and make that determination. And so I'll use the extremes again. If you're talking about going on a hike and carrying a mask for the 1 or 2 times that you're going to brush past somebody momentarily for 2 seconds, you know, that's a pretty low risk activity. But if you're talking about a wrestling tournament in, you know, a gym somewhere with 100 people, that I would say is a very high risk activity. And so you're going to have different things fall on the continuum anywhere in between, but those are the factors that we should all be taking into account.
You know, and I mean, I don't really have a whole lot else to add to that other than, you know, I think that anybody right now in a leadership position is challenged, and the school districts, the leadership of those districts are challenged by the same things we're challenged by, all of the differing opinions, the differing ways that people want you to act. And, you know, we just discussed mental illness and the challenges of behavioral health, and it is affecting our children. And it is very clear that children need to be with other children. And it is one of the most difficult decisions to have to make. And I think that the schools are trying, and the leadership of schools are trying to be flexible in considering all those things. And just like we're dealing with things, it's going to be dynamic, and they need to consider all aspects of it and the science of it. And they're trying, but these are difficult times. And, you know, your decisions affect people in ways that are unimaginable in the careers that you entered in the decision making that you have to make. And so I think it's following the science of what's taking place. And I think that schools are trying to do that, but it's really a very, very difficult situation for them to be in.
I think that they both answered the question very appropriately and gracefully. So I appreciate that. You know, I would just add one thing, and it's the fact that I think people have to remember we are living in unprecedented times. And although it's dragged out longer than many people hoped, everyone's hoped, let's be quite frank, we still are living in these unprecedented times that every day times are changing, things are changing, more information comes out. So with regard to a situation, you know, I just think of something like if you have a child in school and maybe, you know, another child in a classroom next door tests positive for COVID. I think a lot of it, you have to do what you're comfortable doing as a parent as well. And sometimes people are afraid to maybe take their child out of school because they feel they might fall behind a little bit, or what other people might think. I think a lot of it comes back to your mental health as a parent as well in the school situation, that you can't lose sight of what works for you and your family as well. And things could change on a weekly basis. You may make a decision, 1 week to remove your child from school because of a certain situation, but then put them back in the following week. It's just a very, very volatile time. And I think the more people remember that, I believe the better they can cope with having to make difficult decisions that may change on a weekly basis. And there really is no right answer for a lot of these things, like Dr. Rue and Kendra said.
And yeah, and I will just add, because this is really very much in United Way's wheelhouse. I'm quite literally daily on the phone with superintendents and principals, and every single one of them are taking this very seriously. And there is a sense, much like there is in medicine, that sometimes being out of school for a certain segment of the population is worse than being in school, even during, or being even in the middle of the pandemic. There are kids who don't have access to the internet. There are children who do come from difficult family situations. So just know that there is more than just COVID that goes into those decisions. It really is, a minute by minute, day by day decision, and they're doing their best. There's no good decision for sure. A lot of questions about the vaccine. I'm interested in hearing from Dr. Still and the nurses on the call. What do you have to say about the vaccine? How can we encourage people to get the vaccine when it's time and assure them of the safety of doing so?
I mean, I would say I'm certainly no expert on the vaccine, and I think we have a lot more data and information to come out. But I do know that there's two vaccines primarily that seem like appear to be highly effective. And I do think there will be a strategy in terms of when they're coming out about who will be able to receive them in the community. And it may be, specifically for the very frontline workers or other things primarily. So I feel like the community at large may accept it more once we have more information and once the distribution has started. So it's kind of hard for me to answer that question right now.
And I think we're gonna, I'll agree with Dr. Still. I think there's still, we've got to see the evidence, right? The initial results look extremely promising. But I think that once we have a little bit more insight and, can take a strong look at the evidence, I think that that'll help us really craft the message that needs to get out to the community, and what the impact potentially could be. But I think it's, we're working hard. I think most organizations, I suspect that FBC and Evangelical, and I know Geisinger has a core team looking at the vaccination and how we're going to get it out and who we get it to. And there's very strict guidelines with, keeping it in storage and, cold temperature. So we're going to have to get through all that. But I think once the evidence comes, we'll have to take those sound bites and really translate that to the community, much like you're doing tonight, and really offering these type of opportunities to get out in front of the community and talk through what we see, with the evidence from the vaccine.
Thanks, Janet. Margaret. Yeah, we are, I'll just mention that United Way is already in discussions with other community groups about how we can proactively promote the vaccine once it's safe, and also make sure that we're following through with proper distribution, and our hospitals have great experience with community health and do a beautiful job with that. Another clinical question while we're on the topic. If I have COVID and I'm not sick enough to go to the hospital, what is the treatment protocol? Do vitamins help? And do vitamins help even in the prevention of getting COVID or getting sick in the first place?
Maybe I'll start, or Dr. Still, do you want to take that?
I mean, I can take some of it, but I'll just do my best in answering that. there's a lot of the information that we don't know for sure yet. But it does look very promising that some vitamins may be helpful in terms of when the person has the disease and possibly prevention. We don't really know, as far as I know, dosing or have an exact vitamin protocol, but we have heard that, vitamin D, C, zinc seem to be helpful for this virus. And I can't really give you, all of the data and information behind it. I don't really have that. Geisinger has an excellent, they work to carefully develop protocols for their inpatient and outpatient COVID patients. So we have an online protocol that's available to us that we can use. A lot of it is specifically geared towards the most critically ill inpatient that I see at this time, but there can be use of different therapies as an outpatient if needed, such as, occasionally if someone has an illness that we think may be a bacterial infection on top of COVID, so maybe the use of an antibiotic, maybe the use of a steroid if we feel that that's indicated in different situations.
Yeah, I think we just had this question come up a few times during our internal town hall recently, our virtual town halls. And I think if I'm remembering Dr. Stan Martin, our chair of infectious disease, I think the punchline here is it's unclear whether vitamins help or not. I think it's what he has said is that there's no clear evidence that it does help. And in particular, I think the one that's anecdotally out there is vitamin D, but that is based on apparently some evidence around the in vivo studies that is, on a cellular basis, but in real world, does it help you as a human being with your body being able to ward off disease or specifically COVID? I think the answer is probably not. And then, of course, there are things that, vitamins just generally, never mind COVID, do they help your immune system? And I think Dr. Still mentioned the vitamin C and zinc, which you all have heard about, even with things like the common cold. Those do have some bearing on being able to strengthen your immune system, but those are not silver bullets. I just want to be perfectly clear. That's not going to prevent you from getting COVID. Does it marginally strengthen your immune system, and is that beneficial? Again, unclear. But I think it's important to emphasize that if people are thinking they can get COVID and then ward off bad effects of it as a result of taking vitamins, that's absolutely not the case.
And I'll just throw in, I think for folks who get COVID and have a mild case, I think it's really a lot of supportive care at home. We're taking care of patients at home every day that have COVID. And so think about the things that you do when you get the flu or a bad cold, right? It's really comfort measures. Take some Tylenol, get your fluids, stay hydrated, rest. I think a lot of the symptoms that people get that are not necessarily serious enough to send them to the hospital are fatigue, a cough, those sort of things. I think fatigue is one of the things that I just hear from folks who have had milder cases that's really pretty aggressive. And so sleep, but get hydrated. Sometimes if your physician, wants you maybe to check your temperature, some monitors for pulse ox and for your respiratory rate, if it's, something a little bit more complex. We've implemented a couple of programs to monitor patients in their homes a little bit more carefully. But I think it's a lot of comfort measures that a lot of us do in normal situations. If it gets a little worse, sometimes physicians, as I think Dr. Still indicated, may use oral steroids, maybe some supplemental oxygen. But as a rule of thumb, you're probably going to feel poorly for a couple of days, and you're going to need to spend some sack time and stay hydrated.
Thanks, Janet. How do I know when to go to the hospital?
So I would say we'll often have patients monitoring themselves, their vital signs, as well as checking their pulse oxes. Many people around here have purchased pulse oxes, and we'll usually be recommending that if they're monitoring their vital signs and their pulse ox has dropped and is dropping down to the low 90s, 91, 90s, lower, definitely. If they're having trouble breathing, if they're feeling very winded, short of breath, they can't catch their breath. If they're having chest pains, those would be some indications that I would definitely say that person should be going to the hospital.
Thank you. So I am let's assume that I'm a young, healthy individual. I don't know anybody who has COVID. It's not affecting me directly. None of that is true, by the way. But let's assume, what do you want me to know about this pandemic and this illness for anybody?
Well, I'll take it. It's not a clinical question, which I'm glad to have the clinical people on this call. I would say to somebody, you need to keep living your life, but you need to be careful, and you need to do all the things that were discussed here tonight with hand hygiene and masking and safe distancing and controlling the social aspects of your life, that you're not in large groups. But if not, you're going to see some kind of impact, and it may not be you directly, but might be you passing this on to somebody else that you love and care about, that will alter your own life. And so it's that notion, what you tell teenagers, that not everything is about you, it's about other people. And COVID is about, being safe, but also being very considerate and concerned for other people that you know nothing about, or that you do know something about and would be devastated if you gave them COVID. And so I think every person has to be aware. This is deadly and it can pass, and you cannot live in some little bubble in which you think it's just never, ever going to affect you. It will.
I agree 100% with Kendra. I, agree with everything you said. And I think one other, takeaway is, to your point, Joanne, if you haven't experienced this yet, that you have someone that you know pretty close that has gotten COVID, you probably pretty soon will. And that's the reality. And until you have that experience, I think it's easy to kind of ignore it and act like it's not a big deal. But once you have an experience where someone close by to you is infected with COVID, it is a little frightening, and it makes you really think about it twice and be like, wow, this could be anywhere at any time. And even though you are young and healthy, that's the case. So to me, it's nowhere near as severe, like Lynn was talking about with patients on an ICU level. You may not have to experience that, but the reality is, when you have someone close by, even infected, even with mild conditions, it's scary, and it makes you really think twice. So that's the only thing I would add to Kendra, but I agree with everything she said. It's not always about you. It's a good takeaway.
Thank you. Is it safe to go to the grocery store right now? What do you all think? Or should I pull into the little, I love Giant Direct. I don't think I'll ever do it differently, ever. I don't think I'm ever going to grocery shop again by myself. But should I be afraid to do basic tasks like that? Go into the grocery store, go into the pharmacy, that sort of thing.
Well, I think it's the same precautions. I mean, I think it's what we've been talking about all along. There are certain activities that are part of living our daily lives, and going to the grocery store and replenishing your food and so forth, that obviously makes sense. I think going at less trafficked hours, not a bad way to go. Make sure you're masking. I think honoring the social distancing within the store, and of course, hand hygiene as well. I think it's the same formula of things that you're hearing all of us talk about in the case of grocery stores.
Thank you. So I'm going to ask 2 more questions. I won't be able to get to everything tonight, but I do want to thank everybody for these incredibly thoughtful questions. I'm interested to know what you think we all can do. We've heard a few things tonight. Encourage 5 people to wear masks, try to get through to people. Is there anything else collectively, the 400 plus people who have tuned in tonight, can do moving forward in order to get people to behave responsibly in our community.
I want to add to something Lynn said about her family and having that difficult conversation with people that you love and respect. I think that that's a big thing that everyone can do on this call because, you know, regardless of what your family situation is, most likely you have someone in your family, immediate family, that might not believe it's as real as it is. And I think that if those 400 people can talk to even one or two people in their family that maybe don't believe it and are not taking it as seriously, that goes a long way. And no better person to have that conversation than someone that you love and respect, because we can sit here all night as a panel and talk about it, and people may want to listen, they may not want to listen, but if your son or your brother or your father has that conversation with you, I think it goes a long way. So that's, in my opinion, one thing that we all can do.
Joanne, you know, I'll say this, and this might, I don't know, be a little bold, but you are, you know, a vocal leader about the importance of taking this seriously. And that is very important. I would say as citizens, as, you know, human beings, you need to call people out and have that difficult conversation, but have that conversation with local leaders who are at times telling people to ignore this, that this is not real. You should be able to do what you want to do. It is exasperating in my role sometimes to know how to counter that. And I think, you know, we need to challenge our leaders and expect leaders to lead us in times of crisis. And at times people need to speak up when they see things that are not accurate. And, you know, it is disappointing at times, but you have to hold your leaders to high standards and challenge them to that you feel differently and that it is not appropriate. And I think that's one thing I'll add. And I appreciate, Joanne, your strong leadership across the region in helping us. You know, Dr. Rue and I have had multiple conversations sort of about feeling like you're hanging out there and what can we do to help people. And this was a real start tonight to help us get the message out to people to take it seriously. So strong community leadership is vital.
I would actually like to follow up with what Kendra said. I just recently heard people from the community saying that the hospital inflates the numbers, the statistical data, so that they get additional government funding, which is ludicrous and frankly insulting to the frontline workers that are here. I mean, it's real. It's real. And people, ignorance is bliss. And people want to pull the covers over their head and think that they're invincible, or they just don't want to be told what to do. I don't know what it is, what the human factor is there, that we just can't all get along in the sandbox and put our masks on, and hopefully this will, you know, die down. The people that were tested today, if they need hospitalized, we may not see them for 3 days or a week, 9 days. But for the 87 people that tested positive in our area, according to the news feed on my phone, if 10% of them come in a week or a few days, that's 8 more people. We don't have 8 more beds. We don't have 4 more nurses. People need to be very, you know, Thanksgiving's coming up, and we should be very thankful for those of us that aren't sick, those of us who didn't lose a family member. We, you know, I lost my mom a couple years ago, and I can't imagine having her die without me present. I can't even comprehend what that would have felt like, not to have a proper burial for her, not to be able to have a funeral because of social distancing and not being able to congregate. It's, people don't realize it. The people that have had this disease or have lost a loved one, please tell as many people as you can. People are on Facebook all the time, you know, taking pictures of their food that they're eating. We need to take pictures of masks, you know, this is what I want for Christmas. You know, everybody just do their part and be part of our relationship with the community, because the hospital is trying, but, you know, we can't do it alone. We got to both row the boat. And I just want to say, Kendra had mentioned earlier that I am very, very proud to say the hospital has always looked out for our safety, and we have the PPE that we need, and we are very, very lucky. We know that we're lucky, and they've done an outstanding job making sure, do you need more hoods? Do you need more shields? Do you need more of this? Do you need more of that? And they make sure that we have what we need. And so if you have to come here, you will be safe and you will be well cared for. But we'd prefer to see you next spring at the Miller Center or at Giant. And we really don't want to see you right now. But that's my little spiel, Kendra.
Thank you, Lynn.
You're welcome.
I don't think any of us could have said it any better. It is 8 o'clock. I want to be respectful of everybody's time. I do want to say this is recorded. It will be available on our Facebook page. If any of you want the actual recording from Zoom, we're happy to share that. Just reach out to us via email. It's available on gsvuw.org, our website. I want to just share a very quick story in closing with you, because I think nothing hammers things home. You know, you can talk about all the data in the world, all the numbers in the world, all the science you want, but really what it's about at the end of the day is people. And if you were here early, you probably saw our slideshow with photographs of people wearing masks. That is the fastest marketing campaign in the universe that we were managed to pull together within 48 hours. And the first person on that slideshow is an 88-year-old man named Tom Ryman-Snyder. He actually is one of my neighbors here in Mifflinburg. And he is a Korean War veteran. Tom unfortunately lost his wife, Peggy, this past weekend. She died at home on hospice. It was a longer-term illness, not COVID. But, you know, I didn't know that Peggy passed, but when I asked them, he and his daughter, to come in for this campaign, they didn't hesitate. Literally 3 days after Peggy died, they were in a photo studio getting their photograph taken. And I asked Tom why it was so important to him. And Tom, you know, many know Tom as a very conservative, politically conservative individual. He is a huge advocate for there's Tom. He's a huge advocate for the military and armed forces, and really just an incredible patriot. And Tom got very emotional, and he said, you know, when I came back from Korea, I was in California, and I was walking down the street and I saw somebody do something really crude to someone else. And I mustered up the courage to go over to that person and say, and challenge them. And exactly what Kendra was saying, you know, we all have to have courage and work to challenge each other when we see something that isn't right. And really that's the name of the game. And he said, yeah, I fought for freedom. It's what I did. And it's what people in the military do. But the reason I fought for our freedom is because I believe in America. And I believe in the power of people. And I believe that Americans are kind and they love one another, and that we can have an incredible impact on the rest of the world. And that's what America is about. And I just, you know, could never say it better than Tom said it. So I just want to say thank you to all of our panelists. There's no good decision right now, but please do everything you can, please, for our friends and neighbors, and especially for our healthcare workers right now. Please, please mask, cancel your holiday plans, do everything you can to get us through this next 2 months. We appreciate you. We love the work we do. Thank you for trusting us at United Way with this community, and bless you all as we go into these next weeks. And if we can ever do anything, please don't hesitate to reach out. Thank you and good night.